Dr. Joyce for his 5 minutes of questioning.
First of all, Secretary Kennedy, I want to thank you for appearing here today, and thank you for your leadership and the concrete steps that you've taken to root out the fraud, hold bad actors accountable, and improve access to care and training for new physicians. Your leadership in the fraud space, including the CRUSH initiative and RFI, pose an opportunity to fundamentally change how we approach these fraudsters who prey on the government, and they prey on government programs to divert precious government funding away from true areas of need. Moving away from the current model of pay first, attempt to recover later, which you mentioned in your statement is very difficult to recover any of that funding, to a real-time detection model will enable government to stop payments before they're even made, which will lead to billions of dollars in annual savings. And that's what this hearing is all about, and I congratulate you for that aggressive stance. Last year, you also acted on bad actors in the organ procurement space, leading to the first ever mid-contract decertification of an OPO. Like you, I share concerns that more needs to be done in this space and look forward to partnering with you and Administrator Oz to address any additional authorities required from Congress. Finally, I am encouraged as a physician to the recent announcement that 53 medical schools are now committing to at least 40 hours of nutrition education as part of their curriculum. I did 4 years of medical school. I did 6 years of postgraduate studies. I had zero hours in nutrition training. It is so important that you've addressed this. And I would encourage all medical schools, not just the 53 that have made that commitment, all to participate and provide that training for our future doctors. In your testimony, you mentioned affordability and actions that you and this administration have taken to lower costs. In our previous hearings on this subject at this committee, one of the biggest issues driving higher costs is the issue of hospital consolidation. Secretary Kennedy, independent physician practices are disappearing, in part due to hospital systems offering compensation arrangements that may exceed fair market value and are not commercially reasonable. In 2020, CMS made it clear through rulemaking that physician compensation must meet standards for fair market value and commercial reasonableness under the Stark Law. This is a growing concern that these standards are not being properly enforced, particularly in hospital hiring practices that may be declining to the independent physician hospitals and independent physician practices. What is HHS doing to ensure that these standards under the Stark Law are enforced?
First of all, thank you for raising that issue. And one of the ways that we've tried to address this is through reforming the site neutrality rule so that hospitals in rural areas are not getting paid less and that the compensation is not less for the doctors in those areas. In terms of investigating that particular fraud, I'm happy to work with your office and with Dr. Oz to make sure that we're targeting it among the long list of other things that we're doing to combat fraud.
Thank you for that commitment. I look forward to working with you and Dr. Oz on that issue. Another issue of concern will lead to more independent practices closing or selling into hospital systems is the recent reimbursement reductions impacting radiation therapy and oncology. As you know, radiation therapy is a key part of cancer care and requires significant capital investment, advanced technology, and highly specific clinical staff. Abrupt reductions in reimbursement threaten the financial viability of community-based radiation oncology practices and freestanding radiation facilities. I plan on sending a letter on this subject to Administrator Oz. Will you commit to look into this issue with us as well to work for a potential solution?
Absolutely. Those offices are critical, again, particularly in rural areas, isolated areas of the country.
In the remaining seconds, are there any additional issues with the barrage of questions that you've been posed by the other side without adequate time to answer? Is there anything that you would like to comment to the committee at large here today?
I mean, I would say this. People said that I'm breaking the healthcare system. The healthcare system was broken when I got here. We spend 48 cents out of every dollar that Americans pay in taxes to the federal government is going to healthcare, 90% of that's going to chronic disease. That's if you include my agency, the Department of Defense, and Social Security. Well, our lifespan is plummeting.
Okay,
Our fertility.
our witness's time is up, but